Hi there, colleague, and welcome to a new video. In this video, I would like to talk to you about the injection technique. Let's get started. In this video, I will tell you more about the injection molding technique, and I would like to show you more and tell you more by showing you a case. For the posterior injection, we can use a clear index, like you see here on the photo. This clear index is made of ExaClear by GC. We can use the same technique for the anterior region, but in this video, we will only talk about the posterior region. Let's dive a little bit deeper into the case. This patient was referred to me by the orthodontist. The orthodontist found out that the teeth in the second and third quadrant had ankylosis, so these teeth were unable to move. After adjusting all the other teeth, there was no occlusion on the left side, and therefore we decided that this was a really good indication to use the injection technique. The injection technique can only be done when we want to replicate a tooth that we have already a copy of. So we need to have either a wax up or a tooth that we will then deconstruct and have to reconstruct, because the injection technique works with an index. And without an index, we cannot use this technique. So therefore, it's important that we have some sort of a mold. Well, what we did in this case, you can see the situation on the left versus the situation on the right. So I sent a scan, an intraoral scan, to the dental technician to make a wax up of the upper and the lower jaw in the ideal occlusion. This is the view from the occlusal point, and you can see that there is also a little bit of crowding on the second quadrant. Since the teeth are ankylotic, we cannot do anything about this position of the teeth. So that's something that we have to deal with. The wax up came back, and what I did, I made a clear index. The index was made in a pressure pot with ExaClear from GC. ExaClear is a transparent silicone material. When placed in a pressure pot, will eliminate all air bubbles, and we can make a really nice, rigid and see-through transparent index. Once we've done that, we can make some sort of holes in there, which we use to place our composite. So we will use that as injection holes to inject the composite into the mold to make sure that we get a really nice copy of the situation that we had on the wax up. Here you can see the situation without the index. And what's really important, as you can see right here, is that not all areas of the tooth are waxed up, because we need to have some sort of the stability of our index. So in this case, luckily we didn't have to do anything on the second molar. So we have a really nice and sturdy fit on that molar. The canine only had to partially be rebuilt, so we also have some stability there, a little bit of stability on the occlusal surface of the first premolar, and also on the buccal and palatal side. When you're doing these cases, you want to make sure that the wax doesn't cover everything of the tooth, because we want to use RubberDam, and therefore it's better if we're not putting composite 360 degrees around the tooth, because one, our index won't be that stable, and two, it's harder to work with the RubberDam. So this is the example of an ideal wax up for the injection molding technique. To make sure that everything was alright, I first did a mock-up. So I placed a temporary material, in this case Luxatemp by DMG. And with this material, I could test whether I liked the anatomy of the teeth and I liked the occlusion. Once I and the patient, we confirmed that this is what we wanted to achieve, we decided that it was time to do the definitive treatment. So first thing we do is use RubberDam isolation. We just use a regular RubberDam isolation. It's important that we isolate as much teeth as possible and that we retract the dam as much as possible. Therefore, I placed multiple floss ligatures around the teeth. So as you can see, there's an anchor clamp on the second molar and I placed floss ligatures on the first molar, both premolars, and on the canine. And then I could check the fit of my index. So here we zoom in a little bit and we can see the rubber dam isolation. And then we have to check and confirm whether our index fits and it doesn't distort on the clamp or on the rubber dam. Because if that's the case, we need to trim the index to make sure that we have a really nice passive seating and that we don't have to force it on there. Because if we have to force it on there and there are some points interfering with the seating of the index, we can get either a distortion or it can happen that the index isn't seated properly, and then we will end up with a situation that is not similar to the wax up that we made. In this video, I will show you a lot of videos of the treatment. So the isolation is done, and now the next step is to clean the teeth. Since we don't need to prepare the teeth or prep the teeth, we use the AquaCare with a 29 micron aluminum oxide to clean the teeth properly. We will remove any calculus, any staining, but we also remove some superficial enamel just to roughen up the tooth a little bit before we proceed to the next step, which will be the phosphoric acid etching. In this case, I use the UltraEtch by UltraDent, and it's a 37% phosphoric acid. We will make sure that with a micro brush we brush it properly in there to make sure that all areas are properly etched, and then we can rinse that and dry the teeth. And then we come to one of the most important but also one of the most difficult stages of the treatment, which is separating the teeth from each other. Sometimes it can happen that the contact point is quite firm, and in those cases we would like to use an IPR strip, for example the Neo Diamond strips by Microcopy, just to go in between the contact points to make sure that that's less of a tight contact point, because we need to be able to place our Teflon in between, because we don't want everything to stick together. We need to raise the teeth quite a bit, so if we don't separate the teeth properly, we will get composite everywhere. So in this case, we will work alternating, which means that we will restore the first molar and the first premolar at the same time. And that means that we need to cover the canine, the first premolar, the second premolar and the second molar with Teflon to make sure that none of the bonding or composite comes onto that tooth and sticks to it. Once we've done that, it's really important to also block out the interdental areas. We will be using the injectable by GC, and this injectable has the viscosity of a flowable composite, which means that it will run everywhere. And if it goes under the contact point and it's fully set, it's really hard to remove. So the better we block out the interdental area, the better it is. I will just let the video run a little bit to show you how I place the Teflon. Here you can see that I use tiny bits of Teflon that I push in between the teeth. It's important that these go into the contact point, but don't stick out that much, because we don't want them to interfere with our index. So it's important that we use small bits, and we place a small bit from the buccal side, but also from the palatal side. So you will see me using small bits in between every tooth. I use 2 instruments to apply the Teflon, because Teflon is your best friend, but also your worst enemy. Even though Teflon doesn't stick to anything, it tends to stick to everything. So it can be really terrible to place it. So if you use 2 instruments, you can use one to hold it in place and the other one to pack it in between the teeth. You can repeat the process for every tooth. If if you see that the Teflon sticks too much, you can always wet your instrument a little bit to make sure that it's better to place. This is what it looks like from the occlusal view. So you can see that we have covered the second molar, or at least the mesial part, and that's fine because we don't put any bonding on the distal part of the tooth. So if a little bit of composite would run under, we can remove it. We made sure that the second premolar is completely covered and also the interdental areas are blocked. And we made sure that the canine is mostly covered and the interdental area is blocked. And this is the ideal situation to start your injection. But we must do one thing first, and that is to apply a little bit of bonding and to make sure that our index is preloaded. Well, how do we preload our index? We can use the tips that are provided with the injectable material to cut a hole in our index. They are quite sharp, so we use one to poke the holes and then we will throw that one away because there might be a little bit of ExaClear in that tip and we don't want to inject any ExaClear in there. Also, we don't want, when we're loading the tip, to scrape off a little bit of ExaClear and get that stuck in the tip and that we then inject that onto the tooth. So therefore I use a periodontal probe from the inside. I go through the hole that I already poked and I use that as a guidance to get my flowable tip in place. The best part about these tips is that you can bend them without breaking. So they are really soft and they are easy to bend and they cannot break. So you can already preload, check again your index to see whether the tips don't interfere with the placement and to check whether your Teflon doesn't interfere. You can subtract the tip a little bit if it's placed too deep inside the index. And then once it's completely fine, you can remove the index again and you can place your bonding. Well, the bonding step, quite simple. I will skip that for now. I will place a little bit of OptiBond FL bonding and that's it. So only as air abrasion, acid etching and bonding. There are no composite restorations, so I don't need any silane or anything else. It's only enamel that I'm bonding to. Once we've done that, the bonding is done, then it's time to do our injection molding. You can see that the flowable tip or the injection tip, it's not really a flowable, it's a composite, but the syringe of the injectable is already screwed on top of one of the tips. I keep the index in place, make sure that it's completely seated and that it's firm, and then I will slowly start injecting. And you can see through my fingers that the injection material is slowly placed on there, slowly placed on the tooth, and we can see all the air bubbles disappear. Since I placed only one hole in the index, we will create some overpressure, which will make sure that all of the air bubbles flow out. So I don't like to use a second air vent on these. I only use one hole in which I inject, and then I let all the excess come out through the sides, which will mean that I will have a lot more of composite on the buccal and palatal to clean up, but at least I have a lesser chance of creating some air bubbles or trapping some air bubbles. If it happens that you run out of the injectable because you need quite a bit of material, you can always just screw the syringe off, screw a new one on, and continue with the injection. With a mirror, I can check whether everything is filled up or whether I have any air bubbles, and that's the best part about the ExaClear, because it's really translucent, so we can see, or transparent, so we can really see if there are any air bubbles or not. And since we made the index in a pressure pot, there shouldn't be any air bubbles in our index, so it should be really transparent and really good to see through. The final part of the injection, I will withdraw the syringe from the index to make sure that I get a little bit of material flowing out from the top, and then I know that everything is filled. So we want to achieve a little bit of overfilling. We place the light, and once we light cured all sides, we will continue to the other tooth. We always like to do alternating because we can work a little bit more efficient. I then continue on to the other tooth. I screw the syringe on there and start the injection process. When we are injecting, we want to make sure that we use slow and steady pressure to make sure that we give the air enough time to be pressed out of the index. Now you can see the excess coming on the buccal. I'm overfilling this index, and once I think I've injected everything, I can withdraw the syringe from the index. Then we keep hold of the index and we can start the light curing. We've now injected 2 teeth, and you can see that because we work alternating, but we didn't have an alternated wax up, which can also be a really good thing to have. So in those cases, in the more elaborate cases where you need to treat more teeth, you can make an alternating wax up, which means one tooth is waxed up, the other one is the original one, the other tooth is waxed up, an original one, and so on and so forth. And then you can create a little bit more stability of your index. Since I didn't have that here and all the teeth were waxed up on the same model, the index is also made on all waxed up teeth. And you can see that a little bit of the material also ran onto the second premolar and even went through that vent out on top. That isn't a big deal because there's Teflon underneath, so it doesn't stick to the tooth, so I can easily remove that. But now you can see what it looks like from the side. Everything is covered. And then this is what it looks like from the occlusal view. So we can see that we have a lot of excess on the buccal, on the palatal, and we need to clean it up. Before we clean it up, we can use this moment to characterize the fissures if we would like to. And that's something that I always like to do. So here you can see me removing the index. We often have a little bit of those injection points still on there. On where we injected, you can see a little bit of composite sticking out, but we can easily remove that afterwards. Right now I'm just using a white light to check for any air bubbles. I use a different setting on the lamp to check whether everything is completely covered, everything is okay, and then I can use my tint to just highlight the fissures a little bit to give a little bit more life to the teeth. I use a little bit on the tip of my fine instrument, in this case the LM Artificura. I do that on both teeth, and then I can use a micro brush to remove any excess. And when you are characterizing your fissures, less is always more. It's always better to try to remove as much as possible and only highlight the small part of the fissure instead of making one large brown spot on the tooth, because that will never look natural. Now I'm happy and I can light cure it, and it looks like this. So you can see that I placed some small amounts, really subtle. Now it's time to clean up the excess. To clean up the excess, you can use a sharp scaler or like a sharp blade, and you can just put a little bit of pressure on the excess that's on the buccal and on the palatal. Often it's a really thin shell that can be easily pulled off. With the Teflon, it's always best to try to twist it in between your fingers and try to pull it out. It can be quite annoying to remove all of the Teflon, but by twisting it and make it more into like a floss, it's easier to remove than when it's just like one big tape. I use this sharp instrument to go around all the edges. And once most of the excess is removed, I can use some IPR strips and some saws. In this case, I used the IPR diamond coated strips, the Neo Diamond strips by Microcopy. Those are really nice diamond coated metal strips to polish the contact points, to remove any excess, and also their saws are really nice to open up some of the contact points, because even though we are working as precise as possible, we often have that a little bit of material is still in between the teeth. So here you can see the saw, and I use that saw to check whether the contact point is open, because once the contact point is open, I can use the IPR strip to round up the contact point and make everything super smooth. We will do this for all of the contact points. So we do distal on the first molar, mesial on the first molar, distal on the first premolar, and mesial on the first premolar. And here you can see the diamond coated strip, which I use to polish everything. And I will only continue once all of the excess is removed, because the more precise I work right now, the better my index will fit in the next stage and the more precise my end result will be. But still, the injection usually doesn't take that much time, but the cleaning up does. So even though you're thinking, well, this is quite an efficient method, I can work really quick, you'll always be surprised how much time it will cost you to remove all of the excess and make everything super smooth. Here you can see that the first premolar and the first molar are done, and we can now continue to the other teeth, which is a bit of the canine and the entire second premolar. We repeat the same process of applying the Teflon, blocking out all of the interdental areas, and we check our index again. So we check the fit of the index, we see that it fits properly. We now have a little bit more support, because we now have support on the second premolar, or on the second molar, on the first molar, and on the first premolar. So we have a lot more stability. We will place our Teflon again, and therefore it's also important that I've already cleaned up all of the contact points and all of the interdental areas, because otherwise it can be really hard to place your Teflon. And the problem is, if I cannot cover the entire tooth with Teflon and a little bit of my injectable runs onto the tooth that I just treated, you will see that it sticks. And once it sticks, it's even harder to clean up. So take your time and make sure that you clean up all the contact points, that you can place a floss in between there without it being destroyed. And once that's okay, you can continue to the next teeth. Replace the Teflon again, just the same as we did at the first stage. And here you can see the injection of the canine and of the second premolar. You can see the Teflon in between the teeth that already were built up. You can also see that there's less excess of material, because the index is now really tight and snug around those teeth. Again, I use my light to make sure that I don't have any air bubbles, and then I can start with characterizing the fissures again. So I'm first checking if everything is completely covered, I don't have any voids or any air bubbles. If there is an air bubble somewhere, you can always poke it through with a sharp instrument, with your blade for example, or your scaler, and then you can fill it up again just by injecting a little bit of material directly into that air bubble. Luckily, I didn't have any air bubbles, and now I continue with the characterization of the fissure of the premolar. For the canine, there's no characterization since there's no fissure. And then this is the result that we have. You can see a lot of excess, especially on the palatal, and we will trim that away. We will remove that. This is what it looks like from the buccal. There's a little bit of material in between the canine and the lateral incisors, so therefore it's really nice that we place a lot of Teflon, since it didn't go all the way through. So this excess is a bit easier to remove. We follow the same principle of removing the excess, and you can see that there's now a large chunk on the pallet top, which only sticks a little bit to the rubber dam, but can easily pull off. And I would rather have this much excess than have none, because if I have this excess, I know that at least I filled everything up. If I inject too little, I will end up with a lot of air bubbles, and that will be really bad. Because if you have any air bubbles, one, they are kind of hard to fill up again. Not the ones that are superficial, but the deeper ones are super hard. You will have to drill again to make them accessible, maybe even remove the entire layer of composite, which can be difficult since you already placed bonding. And if you don't spot them, or you think I will just leave it, what will happen due to the forces of mastication, all those areas will collapse. So there's a small layer of the injectable on top, which will crack, and then in a few weeks or maybe a few months or a few years, you will see the patient back and a lot of the material just broke off because there were some voids underneath the surface. So it's really important to make sure that it's one block of material without any air bubbles. Now it's time to remove the Teflon again. This is also really hard to do, and then we can use our saw again to open up the contact points to make sure that we can at least place our IPR strip in between, and then we use the Neo Diamond strips by Microcopy to polish everything and to make sure that everything is super smooth, that when we go through with our floss that it doesn't fray or doesn't tear. At the final step of the treatment, I can use some burrs, and in this case I use the Karma Direct Posterior Burr Kit to make sure that I polish all of the excess of composite, make sure that all the transitions are super smooth. Sometimes there are some bits of composite in between the teeth that you cannot pull out with a blade or with your scaler. So in those cases your burr can be really handy. We switch to a little bit of a wider burr to make sure to polish all the transitions. And once that's done, we can use our polishers to make sure that we get a really nice gloss on the teeth. We check all of the contact points with our floss just to see if it doesn't fray and doesn't tear. We see that we still have a contact point. And now we use the Neo Shine system by Microcopy in combination with the Neo discs to get a really nice and high gloss of our restorations. For this system, I use around 7,000 to 10,000 RPM, and I let my assistant spray a little bit of water on the teeth. You don't necessarily need water when you try to polish this, but by using a little bit of water, you make sure that none of the dust that we create with the polishing will gather in the fissures, because that will be really difficult to remove, and then your end photo will look less optimal. So it's just for the aesthetic part, for the final picture. By applying a little bit of water every time, we will rinse away all of the dust, which makes it easier to get a nice end result. This is what it looks like from the side. We can just do a little bit more cleanup, make sure that everything is a bit more smooth, and this is what it looks like in the end, and that's a really nice outcome. This was my case about the injection technique. I can understand that you might have some questions, so if you have any questions, feel free to comment down below and I will try to answer them as good as possible. If you're interested by this and you would like to know more about the restoration of tooth wear or using the injection technique, with Karma Dentistry we also organized the course called Karma Wear. It's a 2-day course where we dive into the use of the injection technique, of the stamp technique. With the stamp technique we use the same sort of index, but we use a little bit of heated composite. So instead of injecting, We put a little bit of heated composite in our stand, in our index, and we place it on top of the teeth. And we will also do some freehand layering on the anterior teeth. So in 2 days, we will treat an entire jaw with different techniques to make sure that we find a technique that works in your hands. For now, thank you for watching. If you have any questions, comment down below, like and subscribe, and I hope to see you in the next video. Bye!